Here you are seeing female pelvis, amenorrhea, history of amenorrhea of 2 months, had DNC few days back. Now is having vaginal bleeding with severe excruciating pain, vomiting, low blood pressure, high. Now what we are seeing is the uterus in longitudinal section. This is the uterine outline. In longitudinal section it measures 8.4. In anterior-posterior diameter it measures 4.6 centimeters. Is not enlarged. Now this is the endometrial canal. This is the endometrial canal, in which you can see different strength internal echoes, and which is consistent with bleed, and the endometrial canal is not dilated, measures 11.1 millimeters, normal is up to 13. This is the urinary bladder in transfer section. This is the catheter bulb. She is being catheterized, and this is the fluid in the pelvic cavity. You are seeing this fluid. This is the fluid. So this is the longitudinal view of the uterus. Now in transfer section, you do see, hopefully you can see that the endometrial canal. This is the myometrium. This is the myometrium anterior, posterior, and this is the endometrial canal. And it contains different strength echoes within it. These bright echogenic areas with no posterior shadowing. However, there is no shiny or strongly echogenic part that if present would have been consistent with RPOC. And you can see fluid, a lot of fluid posterior to the uterus with bowels. This is the bowel segment with dirty shadow. This is the fluid. This is the endometrial canal. See the characteristic appearance post DNC. This is collection blood post DNC. Now this is all fluid, and fluid contains low level echoes in transfer section. Here in the region of the left head in excerpt, you see wormy appearance, layered out area, this one, which is a bleed transforming into a clot. So this is the echogenic area, measuring approximately 5.3 centimeters into 4.0 centimeters. This is the uterus. This is the endometrial canal. Again with full of echoes, different strength echoes. This is the fluid in the pelvic cavity. This is the fluid in the pelvic cavity, this area marked by an arrow. And this is the bowel. These are the bowels giving dirty shadow posterior, floating within this fluid. And this is the formation of clot. So this is in fact, to my understanding, without any clinical notes or lab, only verbal history that I informed you was available. Now with that verbal history, what my conclusion will be that this is a ruptured ectopic pregnancy because the uterine outline is intact. The outline of the uterus is intact. You see, this is the posterior wall under anterior wall. So there does not seem to be any breach within the myometrium, longitudinal or transverse section. So this is an ruptured ectopic pregnancy with collection of blood transforming into a clot this area. In a ruptured ectopic pregnancy in the left fallopian tube. Because you see, this is the uterus. This is a small amount of fluid with echo. This is the fluid with echo. Bowels, bowel with shadow. This is the fluid. So now when I move upwards, I see fluid in the right para-colic gutter. This is the left source muscle. This is the left iliosource muscle. And you see, this is the fluid, and these are the bowels floating in this fluid. So fluid is present in the right para-colic gutter, which is bleed. Indeed. And when I go to the abdominal region, on the right side, again there is fluid in the right para-colic gutter, and the fluid, note the amount of fluid. This is the iliosource muscle. This one, this striated shape, longitudinal structure is the muscle, right source, and this is all bleed, all fluid, all fluid. You can see entering the pelvic cavity, and here we are. This is the uterus, endometrial canal, bowels, fluid, fluid with bowels within. Now this is the kidney, right kidney. This is the right kidney, this area, and this is the fluid in the right para-colic gutter, and then it enters the MORRISO'N's pouch. You see, this is the fluid. This is the transverse section. This is the liver. This area, this is the gallbladder. This is the transverse section of the right kidney, and this is the fluid. This is our fluid in the MORRISO'N's pouch. However, no fluid is seen surrounding the anterior surface of the liver. However, let's see this side. No fluid there. Fluid is present in the MORRISO'N's pouch, and here it travels down into the pelvic cavity. Then it extends into the right para-colic gutter here. And it is seen surrounding the spleen. Now you see that here not only it surrounds, there is a cytic fluid. This is the bleed. This is the area of spleen. This is the spleen. So this is the fluid with echoes. Bleed. This is the fluid with echoes. This is the spleen, and this is the right hemidiaphragm. Left hemidiaphragm. This is the fluid in the pleural space. So this is the minimal pleural effusion. It is reactive or sympathetic. Thank you very much.